Hi, my name is Anke and I will give you a brief overview of our work on evaluating soft organ-shaped tangibles for medical virtual reality. In expert domains, users develop rich sensomotor skills and tacit knowledge. Surgeons, for example, rely on anatomical knowledge and tactile experience in their work. Therefore, we investigate if tangibles with realistic material properties can support surgeons in planning interventions. For this, we developed a virtual reality application for surgery planning. It uses two different liver tangibles for interaction. They have the same weight, but are different in material properties. A solid model is created using 3D printing, whereas a second soft model is cast with gelatine for a more realistic haptic feeling. In VR, two virtual models of real cases are presented, and diverse functions such as annotation or virtual removal of tissue are implemented to allow the surgeons to plan the surgery. In a study with 13 surgeons, we investigate the influence of the different materials for tangibles on usability, task load, user experience, and perceived realism. We also conducted interviews with the surgeons to find out more about their experience with the two models. The results showed that the soft tangible was preferred by most of the participants. It was also perceived as significantly more realistic, and the haptic component of the UEQ Plus received significantly higher ratings compared to the solid model. The task load and usability showed no significant difference, indicating that both models are suitable for interaction. The interviews revealed that the soft model was easier to grasp for the participants because of the softer and less slippery material. The models were also perceived to have a different weight, despite the fact that they both weighed exactly the same. Our findings show that the material properties of tangibles play an important role in how they are perceived by the user, but also for the interaction and how the tangible can be handled. This is especially important for users that rely on tactile experience in their daily work.